Imagine the shockwave that rippled through the healthcare industry when United Health Group, UHG, revealed the staggering final tally of individuals affected by the Change Healthcare data breach. A jaw-dropping 192.7 million people. This number is almost double the initial estimate, making it one of the largest data breaches in healthcare history. But here's where it gets controversial. The breach not only exposed personal information, but also disrupted patient care and claims processing for months across the United States. The investigation and response to this massive cyber incident, which occurred in February 2024, are now largely concluded, according to UHG. However, the aftermath has left many questions unanswered and emotions running high. Let's dive into the details and explore the broader implications of this cyber attack. In a letter dated July 31st, UHG announced that it had completed its review of the data, determined the scope of the incident, and finished mailing written notification letters to all affected individuals. The company also provided an update to states like New Hampshire, detailing the challenges faced in reaching everyone impacted. UHG explained that while efforts were made to deduplicate individuals included in the numbers, complete deduplication was not feasible. This means that some individuals may have received multiple notifications, adding to the confusion and frustration. About 1.3 million of the affected individuals were connected with healthcare organizations that did not delegate the breach notification responsibility to Change Healthcare. Approximately 1,252 of these individuals reside in New Hampshire. Additionally, Change Healthcare updated its online HIPAA notice on July 31st, informing affected individuals that the incident call center, which opened on June 20th, 2024, will be closing on August 26th. This date marks the last day individuals can enroll in UHG's complimentary credit monitoring and identity protection services. UHG stated that the review of personal information potentially involved in this incident is substantially complete. The larger trend here is alarming. Change Healthcare, which processes approximately 15 billion claim transactions for hundreds of thousands of physicians, pharmacies, and other healthcare providers, was targeted by the Black Cat ransomware group. This attack highlights the vulnerability of healthcare systems and the critical need for robust cybersecurity measures. In the aftermath, UHG had previously sent progress updates to states like New Hampshire on the status of patient notification letters, including those on behalf of clients who had delegated their notification responsibilities to Change. When lawmakers grilled former UHG CEO Andrew Whitty within weeks of the attack, he revealed that the infiltration occurred in Change's oldest systems, which were not yet updated with multi-factor authentication. This admission sparked a wave of criticism and raised questions about the company's cybersecurity practices. Whitty also disclosed that Change paid a $22 million Bitcoin ransom after the attack and pledged to upgrade its subsidiary with cloud-based security. This move was seen as a necessary step to prevent future breaches, but also raised concerns about the effectiveness of such measures. Whitty faced lawmakers again in December, this time defending UHG against a backlash of consumer complaints about claims denials following the fatal shooting of United Healthcare executive Brian Thompson at an investors' conference in New York City. This tragic event added another layer of complexity to the already tumultuous situation, leaving many to question the company's leadership and response to the crisis. And this is the part most people miss: the human cost of such breaches. Beyond the financial and operational impacts, the emotional toll on patients and healthcare providers cannot be overlooked. The disruption in care delivery and the potential exposure of sensitive information can lead to long-term trust issues and anxiety for those affected. It's crucial for healthcare organizations to prioritize not just the technical aspects of cybersecurity, but also the human element, ensuring that patients feel supported and protected. In conclusion, the Change Healthcare data breach serves as a stark reminder of the vulnerabilities within our healthcare systems. As we continue to rely more heavily on digital solutions, it's imperative that we invest in robust cybersecurity measures and prioritize the well-being of patients. The question remains, how can we better protect our healthcare data and ensure that such breaches do not happen again? We'd love to hear your thoughts and opinions in the comments below. Do you believe UHG handled the situation appropriately? Or do you think more could have been done to prevent this breach? Let's start a conversation and work together to find solutions.